working at the Pride Clinic. People are kinder than I'll ever realize.
I feel so incredibly privileged to be able to give back to this community that has welcomed me with open arms.
Every time I come here and see all the volunteers that have given their time, and especially the faculty physicians who take time out of their busy schedules, it just reminds me that people really care.
The Pride Clinic provides unique services to a population of patients not only in San Antonio, but actually in other parts of the state who have found this clinic to be appropriate for them, in particular to provide the needs of people who are interested in gender transition and to obtain specifically medications to assist in that process.
They rely on opportunities and resources like the Pride Clinic to be able to come and seek out the healthcare that they need, like HRT, which is the hormone replacement therapy, or just even getting primary care, which we do offer here to the LGBTQIA+ community.
Medicine historically has not been kind to LGBTQ people, and to create a safe space at the Pride Clinic to serve a lot of trans and queer folks really has just made my entire medical school career.
I find that I'm finding my voice as a patient advocate. I'm learning all of the difficulties that these patients go through to get health care, and I relate to these difficulties because for a long time I didn't have health insurance, and it is very difficult in this environment to acquire health care.
Working at the Pride Clinic is really just having the opportunity to work with the uninsured patients and learning more about how not having health insurance or not having access to the right health care is really a problem to them. So we really want to close those gaps in the healthcare.
Students and staff here are expected to study materials that are very important as far as treating transgender population.
We receive a lot of safe space training, which is important to help us understand the mindset of some of our patients so that we know that what to avoid re-traumatizing them. Caring for those who can't access healthcare is so important because healthcare is a right. Our society treats it like a privilege, and it is not a privilege, it's a right. Everyone deserves to be healthy.
Ultimately, as a future physician, I hope to continue to serve queer people through providing gender-affirming care and by providing a safe space in medicine.
Working at Pride most helps me prepare for the future in growing my confidence. This clinic, every time it opens, I get a really good knowledge of like the labs and the healthcare plans that we set for our patients.
I really hope that as a future physician that I can hope to educate other students, educate other physicians on just how to treat people with kindness and how to create safe spaces.
My work at the end of the day is a remembrance. It reminds me why I'm in medical school. Sometimes we just get so bogged down with all the lectures and all the classwork that we forget that at the end of the day we're here to interact with patients and help people.
I take away wonderful stories of individuals who have had lots and lots of difficulties in the past. Many of them would not be able to have a medical home at all, and are willing to travel many miles to be able to come to our office.
Our patients come in, they have a great experience, and they go out into the world and tell their other friends about how great the clinic is, and that's how we've been able to spread our wings throughout San Antonio and around Bexar County.